What if there was a pill you could swallow that can transmit health updates in real time? It sounds futuristic, but it's already here. Smart pills are capsules with tiny sensors inside. When they reach your stomach, they activate using natural fluids and send a signal to a small patch worn on your skin. That patch relays the information to your smartphone, confirming the pill was taken. The sensor itself doesn't stay in your body. It becomes inactive within minutes and passes naturally within a day, just like food. In 2017, the FDA approved the first digital pill, Abilify MyCite, for psychiatric conditions. It was designed to solve one of medicine's biggest challenges: adherence. Because up to half of patients with chronic illness don't take their prescriptions as directed. Meet Emma. She's 32, living with bipolar disorder. Like many patients, she sometimes forgot her medication, not out of neglect, but because life is busy and symptoms themselves can disrupt routines. Missing doses meant mood swings, hospital visits, and lost workdays. Her doctor prescribed a digital pill. Each time Emma swallowed it, the sensor activated, sending a signal to her patch and logging it in her app. If she missed a dose, there was simply no signal. The app reminded her gently, and her doctor, with Emma's consent, could see her adherence record. For Emma, the difference was profound. Fewer missed doses meant more stable moods. Fewer hospital visits meant more time at work and with family. She described it as peace of mind in a pill. But here's what we need to talk about. Because every time Emma swallows that pill, data is created. A timestamp, a location, proof of compliance. Right now, that data helps her and her doctor. But data never stays contained. Insurance companies already use fitness trackers and genetic tests to adjust premiums. In 2021, John Hancock began offering life insurance discounts for Apple Watch wearers who hit activity goals. How long before they demand pill adherence data too? Sorry, you missed too many doses last year. Your coverage is denied, or employers. We need proof you're managing your condition. For workplace safety, you understand. If you're a pilot, a truck driver, or work with heavy machinery, suddenly your employer has a legitimate safety interest in your medication compliance. And once that door opens, where does it close? The pill that gave Emma peace of mind could become the pill that reports her to someone she never agreed to share with. Right now, smart pills are voluntary. Emma chose this. But voluntary has a way of becoming mandatory. First, it's, this could really help you. Then, most patients find this beneficial. Then it's, your insurance covers this, if you use monitoring. Then, we can't approve coverage without adherence data. Suddenly, the choice isn't between monitoring and no monitoring. It's between monitoring and no medication at all. And the scope keeps expanding. Today, it's tracking if you took your pill. Tomorrow, it's tracking your gut microbiome. Next year, maybe it's tracking what you eat, your alcohol consumption, your stress hormones, all for your health, all generating data, all feeding systems you don't control. The technology doesn't stop at what's medically necessary. It goes as far as it's technically possible and commercially valuable. But this technology does have real value. For decades, checking the stomach or intestines meant an endoscopy, a camera on a tube passed down the throat. Effective, yes, but uncomfortable, invasive, and often dreaded. Now imagine replacing that with a capsule you simply swallow. No sedation, no hospital procedure, no tubes. Just a pill that travels naturally, sending back data as it goes. For many patients, that's not just innovation, it's relief. Researchers are already expanding these sensors into new areas. In gastroenterology, ingestible capsules are being tested to monitor gut health, pH levels, and inflammation, offering a non-invasive alternative to endoscopies. In chronic disease management, studies are exploring how smart pills could help patients with diabetes, heart disease, and cancer by timing drug release more precisely. Smart pills dissolve naturally, leaving no trace in your body. But they leave a permanent trace in your data profile. They give patients and doctors a shared window into adherence. But they also give insurers, employers, and data brokers a window into your body. For Emma, it meant stability and confidence. For others, it could mean surveillance and control. Smart pills could give us healthier lives. Or they could give corporations an unprecedented window into our biology. The difference isn't the technology. It's the choices we make about who owns the data, who profits, and what safeguards we demand. If you enjoyed this episode, subscribe for more futures.